Tonight, the Target 12 investigators uncover a skyrocketing number of opiate prescriptions provided to our veterans. And we found out there's concern that easy access to painkillers is leading to more cases of addiction.
I mean, they tried almost everything, and it was just always, the answer was another pill.
According to his brother, a local Army veteran received hundreds of opiate prescriptions over the past decade.
Plus, the local VA sits down with us to talk about the issue. Target 12 investigator Walt Buteau is here now with what he's learned.
It took Target 12 months to track down this data from the Department of Veterans Affairs. Unanswered is how many veterans use this pain medication to numb mental pain. Among the thousands of Rhode Island boots on the ground in the Persian Gulf in the 90s, Private First Class William Cotham, who was a Patriot missile crew member. Cotham came home at the end of '99 with a shoulder injury and PTSD mental wounds he kept to himself.
I would say he was very distant, very, he didn't talk much about anything.
Chris Cotham says he often went with his brother to the Providence VA for appointments to treat the pain.
I think it started with Percocets. At one point it was Oxycontin. Anytime something didn't seem to work, it was just always, here's another prescription.
Private Cotham kept a handwritten time log of the pills he took over the years. About the time of his first dose in 2000, the number of opiates prescribed at the Providence VA and across the country started to skyrocket. According to documents obtained by Target 12 through a Freedom of Information Act request, the Providence VA gave out 3 opiate prescriptions in 2001. By 2013, the number was 2,388, almost 800 times higher, and the opiate prescription rate is about the same this year, according to the documents. Providence VA Dr. Peter Friedman tells Target 12 the increase at VA facilities mirrors the country's use of the painkillers.
I think we recognize that there are some veterans who are being treated inappropriately with opioids.
According to his own handwriting on March 9th, Cotham popped several Tramadols at 1:29 in the morning. At 8:37 that night, in what would be the last entry in the log, Cotham took more of the opiate to bring the total he had for the day to 53 pills. Private First Class William Cotham was dead the next morning from an apparent accidental overdose.
A visit with the psych doctor would be 5 minutes to say, oh, let's try this, here's the new script, and out the door we went. They never took the time to get to know him.
Do you think they should have recognized that he had a problem?
I definitely think they should have.
Friedman tells us the VA is taking several steps toward helping doctors learn more about safe prescribing, and he says now doctors and patients are signing treatment agreements.
It's a documentation that a conversation has occurred between the patient and the physician in terms of what to expect for the medication.
Cotham is a counselor now and understands his brother was responsible for his own actions. And while he's hopeful the VA will prescribe opiates more safely, he's frustrated by how his brother was treated.
He was supposedly being taken care of by a system that let him down completely.
Friedman tells us the VA is working on streamlining the process of moving a veteran from a primary care physician to psychiatric care. With the Target 12 investigators in Providence, Walt Buteau, Eyewitness News.
There is more information about veterans and opiates on our website, including a breakdown of the number of prescriptions written to local veterans and how the Veterans Administration is changing how it serves patients. It's all on WPRI.com.